Hello, my name is Rebecca Henderson, and this is my inspirational speech for COM-181. Today we're going to be talking about integrating humor into modern medicine, and we're going to be talking about the life of Dr. Patch Adams. If you'll look over here, this is the real-life Patch Adams. This is the movie based on Robin Williams. This was a 1998 movie, and he's actually a physician, and this is his profit-free hospital that he made. How many of you in this room have heard of Patch Adams before?
I have.
Okay, so 3, so about half of the people here. He is a real doctor. He has a real practice in Illinois, and he's the co-founder of the Gesundheit Institute, which I talked about, the profit-free hospital. We've all heard the phrase that laughter is the best medicine, but does that really make a difference to patients? Before I answer that, there is some serious things we need to discuss. There are certain times in the medical career that you will come across that are inappropriate for humor and for laughter. Some of those being when someone passes away or when someone is in severe pain. They may not think your jokes are very funny, so you may want to hold off on making them entertained for the evening. You want to treat their pain. You want to make them feel better. Humor should never compromise a patient's level of care that they receive or their dignity. However, when humor is used as a form of alternative medicine and integrated into their care, I really believe that patients can benefit from this vastly. Patch Adams also poured the same beliefs into the Gesundheit Institute and his works. He used a lot of laughter therapy and clown care. That's what we'll be referring to during this speech. There are 3 main benefits of laughter. It can be divided up into physical, mental, and social. The physical benefits of laughter are that it promotes relaxation, it boosts your immunity, it increases the amount of endorphins, or the feel-good hormone, it decreases pain, and it decreases your risk of cardiac disease. Mental benefits include that it relieves stress and anxiety, improves your mood and perspective, strengthens mental resilience, which is a way of coping with stress and trauma. If you can laugh about it, you can get through it. The social benefits of humor include it strengthens relationships and it attracts other people. You get friends, you can acquire more people, and you can laugh about stuff, and you can develop relationships and get through whatever you're getting through with people. It also helps to diffuse conflicts as well. When integrated as a form of treatment, humor can help the provider earn patient trust as well. If you can get them laughing, they feel like you have confidence. They feel like you know what you're doing. If you can joke with them, they're going to be more comfortable with you. It can also, like I said, decrease their pain, decrease their anxiety, and influence a positive perspective and positive change in their mood. Now, the clown care, as inspired by Patch Adams, is a way of connecting with patients. He stated that he wants to provide love. He wants to directly give these people love, and people don't just open up to love. We're taught from a very young age to protect ourselves. We don't just off on a whim and just fall in love. But to integrate this care and to make people laugh, that's a way of breaking down that barrier. It gets the nervousness to go away. It lets you integrate this form of intimacy, of care, and they feel that. You can see that. It promotes a happier life, a longer life. And initially, as healthcare providers, we are taught not to get too close to patients. We're told to build that wall up. Don't let yourself get too close to this person. Do not let what's going on with them affect what you do as your job. But Patch Adams was very different. He said, if you can make them laugh, if you can make that wall break down, do what you have to do as a care provider. Lay on the floor and roll around. If that gets that person to laugh, if that breaks down that wall, you're doing your job as the best you can to make that person feel better. Patch Adams also said that we need to stop treating the disease. We need to start treating the patient. The patient is a person. A lot of times as medical providers, it's easy to get caught up in their symptoms and their medicines and their care. We have our job to do, just like they're trying to get better. That's their job to do. And if we can go about treating that patient instead of treating their disease, I think the healthcare profession as a whole will be a lot better for that. And it's okay to laugh with patients. It's okay to cry with patients. We're taught, like I said earlier, from a very young age and from the beginning of our healthcare careers, that we are not supposed to get too intimate with these people, laugh with these people, cry with these people. It helps them get through whatever they're getting through. And at the end of the day, you will feel better for it, and so will the patient. Traditional medicine is a true marvel. We have medicines that are fighting cancer, and diseases that would have killed people thousands of years ago are just curable in ailments now. But at the same time, traditional medicine cannot make a person with dementia want to eat. It can't make an amputee feel the motivation to get out of bed and try walking again on that prosthesis if they fell 4 times yesterday. Sometimes you get these people joking, you get these people laughing, you make them feel comfortable, and they will eat, they will walk, and they will move. Using humor as a person's expense as a way of spreading love and compassion. It's providing a high level of intimate care for these people, and it's highly rewarding. In my hospital, I've done just about anything to make a little kid laugh, to make an older person laugh, to get over the fear, the nervousness of being in an emergency room. I've made puppets and gloves out of tongue depressors and all kinds of stuff just to make these little kids and these older people especially, not just those little old people and the little tiny humans, we make anybody laugh to get over this, that we can treat you, we can make you feel better, trust us, feel confident in us. And at the end of the day, that's what we're here to do. So if you can make someone laugh, it'll probably cure all their ailments, except for diarrhea. Thank you, and this is my speech for COM-181.